So my first introduction into plastic surgery occurred when I was 12 years old and my mom had an accident. At that time, she required plastic surgery to reconstruct her nose, and I was introduced to the plastic surgeon that performed that operation. And my interest in medicine continued to grow, and she knew I had an interest in medicine. And it was an opportunity then for me to start following her in her practice at Rancho Los Agamitas Hospital and also in her private practice. At the end of the day, when I look back at my life, I have to decide, have I made a difference? And in just even looking at one patient, I can look back and say, yeah, I made a difference. So it's exciting. I enjoy clinic. I enjoy sitting down and talking with my patients. I enjoy going through the pathway of either cancer reconstruction or aesthetic surgery or whatever that path may take, and going through that process and helping them to the end goal. In any consultation, sitting down with a patient is a partnership. It's a partnership that a patient has to enter into. It cannot be on the surgeon 100%. And that partnership is to really outline, number one, what are the issues involved with the patient? Number two, what, from a surgical standpoint of view, can I or can I not do? And number three, setting what are, I think, expectations from both the patient and the physician side so that you can kind of agree on what those expectations are long term.
Well, when I first met Dr. Evans, he explained everything in detail to me. And he actually literally took the mirror and he showed me exactly what he was going to do. And he said, you know, it's only if you feel comfortable. I'm a person that gets very anxious at first. And once I saw the environment, and the other thing that I was really happy about is that the surgery was done here in his office. And the follow-up was amazing. He called me that evening just to check up on me.
Quite often, you know, doctors can come across as being very cold and standoffish, and it doesn't give you that kind of sense like I could ask a question. But here is very open, and they welcome questions. They want you to ask questions. They want you to leave comfortable, knowing, and knowledgeable.
I have had the opportunity to work with surgeons throughout the world and work with research scientists throughout the world. I think one of the concerns that we all have in the United States sometimes is we're a little US-centric and perhaps not open to a lot of procedures that are performed throughout the world. So having that opportunity to visit physicians in their practices, to go on rounds, to talk about patients, to look at different ways to come up with answers to a problem, I think gives me a very interesting background in dealing with whatever issue the patient brings into the office.
My experience here at UCI with Dr. Evans and Dr. Ali and all the physicians here at UCI is they are always up to date on their medicine. They're very progressive. They know the latest and they're very educated. And I wanted that. I wanted somebody who was up on the most recent technologies. And here at UCI they are.